The patient in this illustration is between 70 and 80 years of age. Most of the patients in my practice between 70 and 80, though not transplant eligible, are able to tolerate a 3-drug regimen. And I think that in my own practice, therefore, I would probably, as noted before, have treated this patient with a 3-drug regimen of bortezomib, lenalidomide, and dexamethasone, because I believe that it produces greater depth of response, which usually leads to long-term outcomes being better. In the patient population who is not transplant eligible, we don't have any data on VRD light. What we do, however, have data is that in patients who are not proceeding on to stem cell transplant, that full intensity regimen of Velcade, Revlimid, and Decadron actually improved survival over the use of Revlimid and Decadron in a study conducted by SWOG. Now, certainly that population of patients included some that were possibly transplant eligible. They were just not meant to be taken to transplant right away. With that piece of information, though, I am more inclined to use a 3-drug regimen if possible, because not only do we have progression-free survival, but also an overall survival benefit, albeit with full intensity Velcade, Revlimid, and Decadron. The question of whether bortezomib use is difficult in patients who have pre-existing neuropathy comes up frequently, and in the elderly, it I think is even more of a relevant factor to take into consideration before deciding therapy. There are patients who have got diabetic neuropathy, and that again can be a contraindication to using bortezomib. The use of bortezomib given subcutaneous these days and given only once a week has certainly reduced the intensity and the kind of neuropathy that we used to see in the past. However, by no means has it eliminated it. So, we are these days trying to avoid, especially in those who have pre-existing neuropathy, the use of bortezomib frontline. However, there is no absolute contraindication that I see in this case to the possible use of bortezomib.